Good afternoon. I'm Dr. Duke Majan here at the Duke Spine Institute Surgery Center, Viera. This patient is got back pain radiating around to the front of his right leg. He has an unusual diagnosis, which is a herniated disc at L2-3. Not many people get herniations at L2-3. It's uncommon. But why does he have a herniation at L2-3? I'll show you. Let's get an x-ray. Lay still. All right. So, what do we see here? Go ahead, Jordan. Take us through. Get a better picture. That's a little blurry. There we go. Perfect. So, folks, there's L5. Next one up is L4, L3. Now, those screws you're seeing, those long screws, they are not, I did not put those screws in. Somebody else did. As a matter of fact, those are really long screws. And he had a fusion done with instrumentation at L3-4, 4-5. Now, he came to me originally with back pain at L5-S1. We fixed the L5-S1. He no longer has a problem down there. But he came back again saying he has pain radiating around to the front of his right thigh in the L2/L3 distribution. Well, what do you know? He's got a herniation at L2-3 on the right side. And that's what we're here to fix today. We call this adjacent segment disease. All right, let's get focused up there. So we're a little higher than we need to be. That's fine. Here we go. Shot. That's not bad. May be able to start a little lower. Lay still. You're doing great. Let's do some num-num.
Keep your head still. You have way too much head movement. I need your head really still. Okay?
Yeah. I'm going to give him some more numbing medicine just to make him more comfortable. The more comfortable I can make him with this medicine, the less that Dr. Berndez has to give him from an anesthetic standpoint, which is safer for the patient. Lay still, okay? So let's see what we got. Is that it right there? Oh, perfect. All right, so we're going to be fixing the disc above his fusion. That's my target. Okay? Lay still. Don't need your help. Yeah. And as you can see, some patients shot are more cooperative. Other patients want to be involved. Lay still. He loves being involved. He and his wife know me quite well. Shot. They are from Florida. A lot of our patients are from outside Florida. Lay still, my friend. Shot. I think I want to be a little bit lower. Shot. Shot. Lay still, you're doing great. Shot. Shot. All right. Shot. Looking pretty good. Shot. Definitely happier with that. All right, let's just get an AP. We're going to take another view from the top down. So how is it that herniated disc can cause back pain and leg pain? Let's show a video to our audience on what causes back and leg pain from a herniated disc. That looks really good. Yep.
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.dukespine.com.
All right, welcome back. We're just drawing. I knew I did all that drawing in elementary school for a reason. Couldn't understand it at the time when I was 6, but now I do. So this gentleman has back pain, 12 years. He has right anterior means the front, thigh pain. Why is anterior important? Well, most people's thigh pain is in the back of the thigh. When you have sciatica, it's in the back. So anterior thigh pain is unusual. When he came and told me about it, I thought, maybe you've got a problem at L2-3, you know, a herniation with a pinched nerve. And indeed he does. That's why we're here to fix it. Are you comfy? All right. No pain? How bad is that on a scale of 1 to 10? 10? Is that where you get your back pain? All right, you get to go to sleep. I need you to count from 1 to 100 out loud so I can hear you in Arabic, okay? So, we tested his L2-3 disc, and he had 10 out of 10 pain. It was concordant, meaning that's the kind of pain he's been getting. So we're done. We're going to get started on the surgery. We're going to place our guide wire down the needle. And let's show our audience what the Duke laser disc repair actually does. It's a transforaminal surgery. Goes through the foramen. Unfortunately, your spine surgeon doesn't know how to do the surgery. Even though it's been around for about 20 years, maybe 25 now. And the fact that your surgeon doesn't know how to do it is bad for you, because your surgeon's going to recommend what they know how to do. And what they know how to do is not in your best interest. So surgeons should always recommend what's best for the patient, right? Whether or not they know how to do the treatment. But unfortunately, I found most surgeons to be unethical. They recommend what they're able to do, what makes them the most money. And you, the patient, are the victim. We want to change that. We want people to get the best surgery rather than what's best for their surgeon. All right, shot. As we go in with the dilator, okay, the only damage we're doing to this patient, the whole body, is that cut right there. All the other spine surgeries do much more damage. I'm giving some num-num to make him more comfortable. Shot. I can actually feel the fascia, the dorsal fascia right here. There we go. So now I'm in the muscle shot, and we're going to do a little numbing medicine in the muscle, because it's really the fascia, the muscle, that hurts afterwards. Shot. Entering the foramen, heading towards the herniation. Shot. He doesn't like it. He's wiggling around a little bit. Let him settle down. Shot. All right. So all that muscle tightening, you saw that a minute ago, 30 seconds ago. See that muscle tightening he's doing? That's causing the dilator to move out of position. So I'm going to wait till he settles down a little more. Take your time. IV issue? Do you need Sarah, come on over? All right. So we're close to the back of that L2-3 disc. 5, 4, 3, 2. You can see the disc itself is binding the die quite a bit, showing you how unusual the center of the disc is. It's really been damaged badly. That's what happens with adjacent segment disease, is the disc is damaged. It's damaged because there's so much pressure on that disc. Remember, the discs are joints. They're supposed to move. They're supposed to take pressure and movement, and they're supposed to move normally. Unfortunately, they don't move normally when they're next to a fusion. So they wear out quicker. Take the guide wire out. We okay, doctor? Burned us? shot? Good. Yeah, I'm fine. All right, let's just wait a minute. All right, let's talk about what's going on here. So we've just placed this dilator along a guide wire that's in the foramen through the herniation, and now we're going to come in with this tube. And this tube is, the whole surgery is done through this skinny little tube. Looks like a metal straw. It's called the tubular retractor. Now, in all honesty, I wasn't taught tubular retractor surgery this small, this minimally invasive. When I was a neurosurgery resident, I had to learn after I got done with my training. And I did learn. I went overseas. I was taught by the best Korean surgeons, the best Chinese, the best German. And I took that knowledge and brought it back to the United States 16 years ago, and I started performing endoscopic surgery here in Florida. And today we've done over 1,600 surgeries. Not a lot, but more than 1,600 more than every other spine surgeon in the United States, except for a couple. Of course, my teacher, Dr. Tony Young from Phoenix, has done over 10,000 of these procedures. I guess you could say I've done probably close to half as many discs. So in the 16 years I've been doing it, I've done probably half as many discs. He's done 10,000 discs. I've done around 4,500 discs in 1,600 patients. All right, here we go. Down the rabbit hole. And down here, what we're seeing is the herniation. Look at that. It's billowing under pressure. The disc is under pressure. Why is the disc under pressure? Luis? Yes. It's swollen. It's swollen. Yeah. It's swollen from inflammation. All right. Here we go. You guys see the tear? Right there, the blue stain, and that's the herniation. Okay? And the annular fibers are white. Where's the pedal? Good. Lasers on. Yeah?
Ready? Yeah,
Ready? Here we go. Questions?
No current questions.
Have we shown the video on how the Duke laser disc repair works?
Not yet.
Let's do that.
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.dukespine.com.
All right, welcome back. Now you understand how this surgery actually works. The laser is used to clean up damaged tissue that's causing pain. That's the simplest way to think about it. I need 5 minutes. And this patient traveled from Vero Beach, Florida, which is down by close to Fort Lauderdale, and it's on the East Coast, a little bit north of Fort Lauderdale. Really nice family. His life I could tell you was destroyed by his back pain. And I'm not going to talk about him, but I'm just going to talk about back pain. Back pain is so debilitating for people that their lives are literally destroyed by it. It causes them to do things they shouldn't do. For example, what is the easiest way to treat back pain is to not be active, right? To lay on the couch, to just stay in front of the TV and not do activities, because activities make this kind of pain worse. So a lot of people will just take it easy and become inactive, right, Jordan? I just see you snooping around over there, so I figured I'd just put you on the spot. Jordan's awesome. I love my team. There's the tear right there. You guys see it? Right there at 12 o'clock? All right, so number one, first thing people do for back pain that's bad, they stop being active. Very bad. Makes the muscles get weak, deconditioned. Second thing they do is they take drugs, right? So either you go to the doctor and get painkillers, or you take over-the-counter drugs. Over-the-counter drugs like anti-inflammatories, they're going to destroy your kidneys. They cause renal interstitial nephritis. They make your kidneys swell. They destroy your kidneys. And then you have kidney problem, kidney failure, okay? Those drugs also destroy your stomach. They cause ulcers. Those drugs, the non-steroidals, increase your risk of stroke and heart attacks. So, first drug people go to is over-the-counter non-steroidal anti-inflammatories, NSAIDs, Motrin, ibuprofen, naproxen, naproxen, BC powder, Goody powder, aspirin. Okay? Bad, bad, bad. Nothing wrong with taking them for a day or two, but anything longer than that, bad. The second type of drug people take is prescription NSAIDs, like meloxicam, Celebrex. Again, bad, 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 destroys your kidneys. So, the next class of drugs is opioids. Opioids are your morphine, Vicodin, oxycodone, OxyContin, Dilaudid, hydromorphone, blah, blah, blah. We all know there's a lot of them out there. That is not appropriate treatment for chronic back pain. You get addicted, you develop tolerance, and you have all kinds of complications from taking those pills. Most importantly, you develop tolerance, so you take higher doses to get the same therapeutic effect. That higher dose increases your risk of respiratory failure. People are dying. Very bad idea. Then you got muscle relaxers. They don't fix anything. So medications are the second bad behavior related to chronic back pain without getting it fixed. The third behavior is alcohol. Alcohol, alcohol, alcohol. Alcohol. So what does alcohol do? Well, it numbs your brain. It numbs the pain, but it also kills your brain cells. And it ruins your life, okay? So people who treat their chronic pain with alcohol, very bad idea. Then there's other drugs like THC, marijuana. Totally unnecessary, very bad for you. Okay, ruins your life. Basically, drugs, alcohol, inactivity, all bad ways to treat your problem. Let's talk about therapy. Does therapy fix your back pain? No, never. Never seen therapy fix someone's back pain. What it does is it helps them stay active and keep their muscles from atrophying. 4 minutes. So therapy is not a fix. It's good, it's necessary, but it will not let your disc, it will not heal your disc. Okay? So really your best treatment is going to be this procedure right here. It's the only treatment that's designed to cure pain from a herniated disc. And that's what these are, herniated discs. Look at the herniation right there, okay? Look at the inflammatory tissue right there, okay? So, I was a bit surprised to see that he had 10 out of 10 pain from this disc. I thought it was just his pinched nerve that was his problem, but he's definitely having back pain from here as well. And he's gonna feel so much better after the surgery. I'm so happy for him. People, don't put off your back pain. You're worth it. Get it fixed. Okay? The toll that back pain takes on your life is massive. You may not realize it because you're looking at one day at a time. But if you actually look at the toll it takes over 20 or 30 years on your relationship, your marriage, your own self-respect, your own dignity, it ruins lives. Okay, cancer ruins lives, but back pain is just as bad in my book. And it's neglected. We neglect it as a society. We ignore it. We pretend that it's not fixable. Well, it is fixable, and it needs to be fixed. So we got to start taking it seriously. Okay, questions from my audience? Lay still, we're almost done.
No current questions, but we do have a comment from Problem Solver on YouTube, and
Sure.
they said amazing.
Thank you. Hope you enjoy the surgery. This is the least invasive, most effective, fastest recovery for back pain in the world. And but believe me, if there was a different surgery we could do that would work just as well or better, I would be doing it. I don't hold back. I used to do fusions because that was the best. My fusions worked really well. I've even published them in PubMed on the National Library of Medicine. But once I started doing these surgeries and I saw how quickly they took people's back pain and neck pain away, this became the best option because it's such a fast recovery and there's no damage being done to their body, and we've never had a complication from the surgery itself. So it's wonderful. All right, just about finished here. There's a lot of scar tissue I'm seeing. That means this has been going on for a long time, this herniation. Just about done, 30 seconds left. If you have a question, don't be afraid to type it up. I'll try to answer it. If you want your MRI reviewed, then use our review link. We do a MRI review for free. And we do it for free because there's so many people out there living in pain that don't get a diagnosis. Really, the biggest purpose of the MRI review is to give you some answers as to why are you having so much pain. And we want people to know the truth. We want them to know why. All right. I'm sorry it's taking me longer than I thought, but there's more scar tissue than I thought. Let's have the grabber. Just about done. Guys, the floor is a little wet over here from the water dripping down. Just want to get all these herniations out. Thanks, Luis. Any questions from our audience?
No current questions.
I think he's going to be really happy with these results. I really do. Laser? I'm going to put this laser in one more time and we'll be done. Some great audience participation today. Really appreciate it when the audience gets involved and asks questions. We like it. That way I know that I'm helping people get answers they want. I will give you the truth as long as I know it. I won't ever hide the truth from you. I believe in transparency and doing what's right for the patient, doing what's best for the patient. Yep. Just about done, 10 seconds. Let's see if we can see this nerve too. I'd like to take a look. There it is, but it's buried in fat, unfortunately. Let me just get this one last piece right here. Sorry, Dr. Berndes, I know I'm making it challenging for you. That's looking good. All right, done. Feel free to type up questions if you have them. I'll be happy to try to answer them for you. Remember, we do have a Duke Spine app, which is free. You can download it on the iOS or Android platform, phones, computers. And it's got some really pretty pictures and content. Most importantly, if you know somebody suffering, don't let them suffer anymore. Let's get them fixed. Okay, good. I'm going to show you the incision here that we use. Check this out. Again, the whole surgery is done through a tiny tube. You guys saw that? Our blood loss is going to be 1 mil. Oh. I think we have one more surgery left. And then Patel's got a facet block. Trochanteric block. He doesn't need anesthesia. As a matter of fact, we were going to do a DPR on him. He's a new patient, came in today from the hospital in pain. Hospital sent him over for laser. Anyway, he ate. I guess he figured, hey, lunchtime I'll go have something to eat. So I told him we can't do anything today surgical.
Are we going to be okay with the next patient with all the procedures as far as the levels?
No. There's no way we can do all that. Huh? Yep. All right, see the incision, everyone?
Yes, we do.
Where's the ruler? Okay, I'm going to show you this, and then we're going to go to a testimonial, and I'll come talk to you. So type your questions up. You guys see this thing? Metric?
Yes, we do.
All right, there's your incision. Literally 7 millimeters, huh? 7 millimeters. See that?
Yes, we do.
All right. Great job, everyone. Great job. So hopefully he'll be happy with the results. Wonderful surgery.
You're all done, my friend. Can you open your eyes for me? It's all done.
All right, Henry.
All done.
Take him away. I'm Dr. Arjik Majan here at the Duke Spine Institute with one of my patients who's traveled from North Carolina because he had some herniated discs in his lower back and he was having problems with the back. What kind of problems brought you to Duke Spine Institute?
Dr. Duke, it was severe pain that I had never experienced before, and pain that scared me so much that I thought it was going to change the way I lived. I've got a family and I'm active, and it literally scared me to death. And as I'm talking to you right now, the hair standing up on my neck, the pain that I was suffering and where I thought I was, I didn't think there was going to be an answer.
And you were pretty much bedridden. You couldn't get out of bed. I remember you showed up here in a wheelchair because any standing was causing sciatic type pain in your leg.
Yeah, there was no doubt. And that's not an over exaggeration where I could maybe get up, like stand for 15, 20 seconds so I could get to the bathroom to go urinate, for instance. But then when I got there, I had to lay on the floor so I could rest up a little bit so I could stand with pain to even be able to try to urinate. And this went on for 2.5 weeks. It was absolutely brutal. And there was no respite. Pain that I had in the past, I could find some position where there was some respite from the pain, and there was nothing.
So your wife is a physician. Was she able to fix your back problem for you?
I wish. No, I mean, she consoled me. And in the town that we come from, we know a lot of folks. And to be absolutely honest, we just weren't getting a lot of help. And like I said, we know a lot of folks, and it was prolonged, and we were talking about pain management and all that, and that's just not for me. And like I said, I was scared to death.
The problem with pain management, unfortunately, is that it doesn't fix the issue when you have a herniated disc and back pain from a herniated disc, because you need surgery on that disc to repair it. That's what the Duke laser disc repair did. And you can actually see here that we went into his disc with the endoscope and we were cleaning out the herniation with the laser.
Yeah.
And the laser actually makes a huge difference. People say, oh, lasers, they're not used in spine surgery, but they are. And they're very, very powerful tools and very precise. So we were able to clean out your discs, remove the herniation. And how do you feel today?
I feel great. I mean, it's probably, I mean, I know I'm on camera right here, but I literally could not walk into the office yesterday. And I mean, you're gonna see my shorts and everything, you'll have to edit, whatever, but I'm able to walk.
That's awesome.
And I'm just, it wasn't even close. I was actually, and I don't know if you can tell from the camera that what my personality is, but I tried to be very polite, and I was apologizing for profusely sweating because I hurt so bad. It's not because of the Florida heat by any means. It's because I hurt so bad. I'd never experienced pain like that. And like I said, there's no
Because
restroom.
you're a redneck too. You know, you're not that far from Florida.
That's
you're
right.
Just up a state or two, right?
That's right.
A
Yeah.
couple of states. So you're feeling better today. It's been less than 24 hours since
Yep.
we did your surgery. You went home an hour after the surgery, back to your hotel with
Yep.
your lovely family who I met.
Yep.
And how do they feel about your progress?
They're happy that I'm happy. You know what I mean? Because they were scared too. You know, now they were putting on a strong front, but I am just telling you, I was at my wit's end. And I certainly are a lot more appreciative of people who have pain that I'm aware of, because when there's no rest from it, oh my gosh, you know what I mean? I was really at my wit's end, and you saved me. So I appreciate you very much.
You are welcome, sir.
Yeah.
Is there anything else you want to say to your fans out there?
Thank you. Sorry, I could have pretty you up for you a little bit better. So just had surgery yesterday.
All right.
Cut me some slack.
Excellent. And you're heading back home today, correct?
Yeah, right, going back on the plane later this evening. The kids are going to swim a little bit down here in Melbourne. I am just going to rest and watch TV, but then we're going to get on a plane a little bit.
Awesome.
Yeah.
All right. Well, congratulations. You
Yeah.
had faith.
Yes,
Took the
I have
leap
faith.
and you got the surgery done.
Yes, sir.
All right. Awesome. It's Dr. Ari Dugmajian at the Duke Spine Institute here in Florida with one of my patients who had the Duke laser disc repair for a back injury, and it was around 6 to 8 weeks ago. And you're back for a checkup. How you feeling today?
I feel wonderful. I feel great. I feel fantastic. I mean, this is the man. He's the man.
Well, thank
And I
you.
came in with a lot of pain. I couldn't believe it. And now I'm virtually pain-free. It's unbelievable.
How long did you have your back pain? How did that start?
Oh God, that happened many years ago at work, at least 20 plus years. And I had other surgeries in the past, and they really didn't help. And this last one, it just got so bad that I had to do something. So luckily, through the grace of God, I came here, and
Amen.
yeah, and I'm A1 now.
Awesome. So you had your surgery, you've been doing therapy. Would you say the pain you had in your back before surgery is still there, or is it gone?
Oh, it's gone. It's gone. I have little twinges now, but they're muscular, and which is fine. That's going to go away over time. But my God, what a relief! I'm ready to get back out there and do all the things I used to do, man. It's kind of exciting. It's kind of fun.
Well, it's important that people understand too, when you have 20 years of chronic debilitating back pain, what happens is the muscles in your back shrivel up and atrophy because you're really not active anymore because it hurts too much. So, you know, we can fix the spine pain, but it's going to take time to rehabilitate the muscles and get them back to normal. So I'm glad we're touching on that. So what does your life look like now that we've gotten rid of your back and leg pain?
Well, yeah, I'm going to go back to what I've always done and what I've always enjoyed doing, which is my automotive hobby. And I'm really looking forward to being able to actually lift things again and getting the contorted angles that I used to get working under cars and stuff. It's just gonna be nice. Quality of life is it's
Not too soon with any of that lifting engines
all right,
and
all
contorting your
right,
body.
yeah, all right. But I have, all kidding aside, I have noticed over the years I developed a way to walk, almost a crab walk kind of thing, and I got used to it, and I got.
Okay, sorry for cutting our testimonial short on you there, but you can go to our YouTube channel, Duke Spine Institute, and we have thousands of videos that you can watch, including patients who have had this laser surgery done on their neck or back, and also video animations explaining how it works. And most importantly, we have about 2,000 live surgeries that we've recorded over the years, in the last 10 years, that we broadcast on YouTube, Twitter, Facebook, LinkedIn, so that you can watch those surgeries. We have some questions we're going to get to in just a moment, but I wanted to tell you what we were doing for this gentleman. This patient, once again, has had a fusion. I didn't do the fusion, someone else did. We get a lot of patients that come to us after having fusions, and the discs above or below the fusion are now worn out. they've got herniations there, and we could still fix those discs and save them and keep the patient from having to have more fusion surgery. So of course, we originally fixed the lower disc at L5-S1. That was a year ago. He did great. But then he came in complaining of pain wrapping around from his back, upper back, down to the front of his thigh. So I got an MRI, and sure enough, he had a herniation above his fusion right there at L2-3. And I just went in from the side and came in right into the herniation and used the endoscope and laser to zap that thing away. I was pushing on the nerve coming out, going down his leg. So I expect his back pain and his right thigh pain to go away. He had a L3, L2, L3 radiculopathy. So we'll take some questions.
All right. First comes from Nick Hollywood on Facebook. And this is not a question, this is a comment. And they said, you have to come to Europe to make this procedure for the people that can't come to America. Your work is amazing.
Nick Hollywood, thank you so much. I appreciate it. We're trying to help people. I wish I could clone myself. Maybe I need to go to China for a little while and make some clones. Joking. But that said, I would love to help everyone around the world. I don't know how to do it. I think it requires a complete change in the way we view back pain and neck pain as a society, as a world. We can now cure it. It's literally curable. Just like there used to be polio and people would get polio virus, they would get very sick, they couldn't move their arms and legs, it was destroyed their lives. And eventually someone discovered a vaccine for the polio virus, and now, like other diseases, we've eradicated polio for the most part, even in Europe. and of course, we should do the same for back pain, because back pain is debilitating, incapacitating, destroys lives. The person suffering with the back pain's life is destroyed. The people around them, their lives are destroyed. And look at all the opioid narcotics that have been developed because of chronic pain. People that can be fixed now don't need those drugs anymore. Our whole societies, whether they're European or Asian or African or American, South American, etc., Canadian, we can fix this problem. And I believe it. I've been doing it now 16 years, 20 years, even including fusions. I've seen it consistently over and over again. The only failures we have are people who have additional problems like facet joint pain or piriformis. They choose not to come and get treated after their surgery. Those are the only people complaining about anything. And we fix them all the time. But once in a while, somebody doesn't want any additional treatment, so they have pain. The point is, if the pain is coming from the disc, which it is 85% of the time, we can cure it with this surgery just watched today. You have to get all the discs. You can't just fix one, you have to fix both. If there's 2 or 3, you got to fix all 3. The point is, if you have 3 discs causing pain in your back, you must fix all 3 discs. You can't fix one and expect the pain to go away. So if it's not the disc, then it's the facet joints. What are the facet joints? Well, here's the disc, this big white thing, and here's the facet joint right there. And that's the second most common cause of back or neck pain, is those facet joints, because they get arthritis, you move, they get scraped and they grind up and they cause inflammation and pain. We can treat that now with a new treatment called plasma rhizotomy, and that's where we go in and deaden the pain nerve to the joint. That is, preserves movement of the joint and it takes the pain away. The alternative treatment is a fusion, but fusions we're trying to get away from because they lock the spine in a position, and that locking it takes away movement and it creates more problems later on. So between the Duke laser disc repair for disc pain, 85% of chronic back pain, and the Duke plasma rhizotomy for facet joint pain, that's about 95% of all back pain right there. Then we also have piriformis muscle pain, which requires shots and therapy and healing of the muscle through massage and stretching and proper biomechanics. And then you've got sacroiliac joint pain, which the big fusions are being done now on the SI joints. That's totally unnecessary. No more SI joint fusions are needed, okay? Instead, you do a rhizotomy where we go in, do plasma rhizotomy and kill the nerves over to the sacrum, okay? That usually can cure about 85% of sacroiliac joint pain and dysfunction. Sometimes the pain is anterior, it's not possible to reach those nerves. You have to still do a fusion, but people are going fusion crazy these days because fusions make so much money for the hospital and the surgeon and the companies making the implants. We have to change this. It's a cultural change that must happen. It will happen, I'm 100% sure. When I first saw the first digital camera, okay, this was back in around 1998, about 25 years ago. They came out with the first digital camera, okay? Now, most of you don't even know what a digital camera is because everyone uses their phones. But this was before there were cameras in phones. There were cameras, and everyone used an SLR camera. They took a picture, it had film, and you took it to a dark room and you got it developed with chemicals, nasty chemicals. And of course you had a picture that you could hold in your hand like a piece of paper. When I saw the first digital cameras hit the market, it was a Nikon Coolpix, and I bought one. And everyone else, nobody knew what it was. Nobody had seen it before, and I started taking pictures and downloading them to my laptop. I said, this is the future of photography. There's no doubt about it. It's so obvious. These digital SLR cameras are going to go away. Of course, the quality of the picture had to improve, the resolution and size, format, and it did. And now digital cameras are really equal to SLR cameras, and you don't see SLR cameras anymore. You don't see film cameras anymore. They're gone. I mean, some hobbyists will get one once in a while to remember the old days, kind of like having an LP player, a record player. But my point is the technology advanced and people went with it. And this endoscopic surgery you watched today, the Duke laser disc repair, will be the surgery everyone does in the future. I mean everyone, like spine surgeons and patients alike. It's just started here at Duke Spine Institute. We're the founders, and unfortunately we discovered it 12 years ago, 16 years ago, but it's hard getting doctors to switch and change what they do, especially when they're making a lot of money doing something they don't want to change to make less money. Okay?
Okay. Next comes from Johnny Bravo on YouTube. And they said, I was told I have bone spurs. Can you help me with this L4 through 5? What are bone spurs exactly? I live in New Jersey. I'm told I have bone spurs at L4 through 5. I have numbness in outside of my feet. I can only walk for 10 minutes before stopping to sit down. Can you help me with bone spurs? All I see is disc surgery on here.
Hi Johnny, you're correct that we can help you with bone spurs. Bone spurs are basically calcium deposits that form in places they're not supposed to, typically around joints. So whether it's the facet joint or the disc, anywhere there's movement in a joint, you can get calcium deposits, okay? The laser can melt any bone spur away, no problem. So yes, we take bone spurs down, we just don't talk about it. Yes, the laser surgery you just watched can fix your problem, 100%. I'm not worried about it. I've never seen a bone spur we couldn't get rid of, okay?
Okay. Then next comes from Sam Petroselli on YouTube, and they ask, how does this compare to a microdiscectomy?
Well, Sam, great question. How does the Duke laser disc repair compare to a microdiscectomy? Many differences. The microdiscectomy has been around 100 years. For the microdiscectomy, the surgeon has to make a cut on your back, pretty big, around 22 centimeters, 20 millimeters. Our incision is 7, so it's about a third. Then the surgeon has to literally peel the muscles off your spine and pull them off to the side. While they're doing that, they're destroying your muscles in your back. Gone. Vaporized. It turns to scar tissue after surgery. Well, then they get down to this little area right here, there, called the lamina. They can't get through it, right? So let's just use this herniation right here. They're coming this way. They can't get to the herniation. They're hitting bone. So now they're going to drill your bone away in a microdiscectomy and take all this bone out. Well, guess what that is? That's a facet joint. So part of the microdiscectomy is a partial facetectomy. Partial because they're taking part of your facet joint out. Facetectomy is facet removal. Ectomy means take out. So partial facetectomy, taking part of your joint out. That's going to weaken your spine. Your spine's going to start wobbling around after surgery. And that's perfectly good for the surgeon because they'll bring you back and say, oh, I'm so sorry, we're going to have to do a fusion now. And so they're going to get a second and a third surgery out of you. Okay? Microdiscectomy, bad. They're also going to take your ligaments out just to try to get to that herniation. So why go through the bone and ligaments and muscle when you can go from the side? That's what we do. We go from the side, my friend. We don't make any damage to your body or your spine except for the skin incision. Besides, microdiscectomy doesn't fix back pain. It makes it worse. Microdiscectomy is supposed to unpinch the nerve to fix weakness, numbness, tingling. The Duke laser disc repair fixes back pain, leg pain, and weakness, numbness, tingling.
Okay, and next comes from NJT on YouTube. And they said, I have no knowledge about this, but now I'm interested. How exactly does it work?
Okay, well, great question, NJT.
NJT.
NJT. So again, I just showed you how it works. We make a small cut in the skin over here, and we use a needle, and we target the herniation. We come through the muscle and get to the herniation right there. Then I bring a guide wire, which then I bring a dilator down the guide wire right there, and we put a tube, and you can actually see the herniation and the tear where it came out of. We use the laser to zap all that away. That's how it works. It works really, really well. Better than any other surgery out there.
We have two more questions. This next one comes from Kimba on YouTube. And they said, I have a large L4-5 disc bulge with L5 nerve root compression with back and leg pain. Should I be concerned that my leg pain gets worse when peeing first thing in the morning?
So Kimba, you have a large disc herniation in L4-5. That's something that we can fix easily with the laser surgery you just saw. It takes about 20 minutes. Should you get concerned that your leg symptoms get worse in the morning? Absolutely. Your herniation is never going to go away. It's only going to get bigger in time, and it's going to do more damage to your body. Get it fixed now while you can.
Next one comes from Yvonne Sosa on YouTube. And they said, hello, Dr. D. I am at a 25% level of scoliosis. At what level will surgery be necessary? I also have degeneration at L4-5, S1, with disc bulging at L4-5. I've had an SI joint shots and an ablation.
Hi, Yvonne. You are unfortunately falling victim, like so many people, to the disorganization of our medical system. You have scoliosis, 25 degrees, understood. You do not need that fixed. What you need fixed is your pain and your symptoms, your back pain, your leg pain, any weakness or numbness. Most spine surgeons today are automatically saying fusion, and I strongly recommend you don't do that. I used to do that for years. Then I learned about the endoscopic surgery. I can fix now back pain, leg pain, weakness, numbness, tingling, sciatic pain, neurogenic claudication, all those problems that come from the spine using the laser without having to do fusions and osteotomies and all kinds of crazy surgery that I used to do because I didn't know any better. Okay? So avoid those major surgeries. They're dangerous. People get complications from those surgeries. They die from those surgeries. Contact Duke Spine. Submit your MRI for review. I will meet with you for 10 minutes. I'll figure out exactly what's wrong, and I can actually tell you where your pain is coming from about 98% of the time virtually through Zoom. As long as I have your MRI and I can do an exam, I can tell you where the problem is or what needs to be done to figure it out. Okay? My advice to you and anybody else in pain, don't go out and have major surgery done. Look into the endoscopic Duke laser disc repair. It can be used to fix your problem about 98% of the time, okay? But you need to get a virtual consultation done. Or come here in person. Happy to see you in person in Florida.
And that is it.
That's the last question. I hope you've enjoyed the surgery. Our next surgery is a 2-level lumbar left side L4-5, L5-S1. That patient has back pain going down the left leg. They are going to have the Duke laser disc repair, and then they're going to have some rhizotomy, Duke plasma rhizotomy procedures for facet pain. So we're going to broadcast the beginning of the surgery and then we're going to cut away for the plasma rhizotomies, and we're going to start broadcasting those later this month. Okay? Thanks. Hope you enjoyed.